Hello there. Good morning. Welcome to another edition of Knocks to Nuggets. My name is Oluwayomi Ute, and such a joy to come your way today. I'm so excited that you are here with me. And for those of you that will watch after, I also want to say thank you. Thank you to every single person for your share of your time. You make this program worth it. Thanks for the feedbacks. Thanks for the comments. Thanks for sharing. Thank you, thank you, thank you. For so many weeks, we talked about mental health at various levels, depression, what to do, how to identify. We had so much on mental health, and I believe it added value. The comments that came from mental health almost kept me talking on mental health. I realized a lot of us don't even understand what we are faced with when talking about mental health. Unfortunately, there's so much pressure on every single person, and mental health is becoming a major issue. But I want to encourage you, slow down, take it easy. God is with you and He will help you through. Really, you can't do anything with worry. So quit worrying, start trusting, start praying, listen to Him and let Him give you direction. And I believe God with you that whatever the dark seasons are, they will pass in the name of Jesus. That was a bit churchy, right? But it's so true. We need God every step of the way. But today I'm so excited. I'm trying to keep my excitement in. I have with me in the studio today a darling, now what's she? Sister, friend, niece. She's so many things. She's that darling friend of mine. And she's talking to us today about drug abuse. What really is drug abuse? She's a public health physician. She's a member of the West African College of Physicians and the Association of Public Health Physicians of Nigeria. Her interest in public care quality also led her to become a member of the International Society for Quality in Healthcare. She's a quality practitioner with the Chartered Quality Institute, United Kingdom. She's currently a senior registrar in the Department of Community Health, Lagos University Teaching Hospital, University of Lagos Teaching Hospital, LUTH. My guest today, for those that know me well, you know already, is no other than my darling. I'm already blowing her kisses. She hasn't come on, but I'm already blowing her the kisses. Her name is nothing else but Dr. Damilola Matti.
Good morning.
Good morning. It's so good to finally have you. Thank you, thank you, thank you for coming on this show. I truly do appreciate it. I don't take it for granted. Trust me, it's awesome having you in the house today. So, Dr. Dami, let's talk. What exactly is drug abuse?
First of all, thank you for bringing me on the show. It's such an honor to be on the same show with my darling auntie. Okay, so drug abuse really is the use of drugs. There may be illegal drugs, there may be over-the-counter medication, but when you're using them for purposes other than that for which it was prescribed, or you're using them in amounts that are not, according to prescription. So that really is drug abuse. You're using the drugs, whether they may not have been prescribed for you, or they're drugs that have been prescribed, but you're using them, maybe in more doses than you should.
Hey, this definitely is too broad. You're going to make all of us guilty of drug abuse at this level. You're saying taking drugs that are not prescribed for you. And I hear you talk about the over-the-counter drugs. Excuse me, ma'am.
Yes.
Am I supposed to go to doctor for everything? I know what to take. The last time I had a malaria, it prescribed ABC. Now I have malaria. Why bother going to the doctor? Just take the ABC. Is that not okay?
Okay, so because malaria, I'll use your example. Because malaria is so endemic in Nigeria, we know what the symptoms are. I mean, like, I'm sure I can virtually say everybody in Nigeria has experienced malaria at some point or the other. So we know what the symptoms are. But ideally, even for malaria, the teaching is that you should get tested. You should get a test for malaria before you use the anti-malaria medications. Now, I do know that these drugs are available. You can, I mean, like you get the TV adverts showing these drugs. However, you ideally should get tested before you use anti-malarials. Now, for things like headaches,
Mm-hmm.
obviously we don't expect you to come to the doctor if you have a simple headache. I mean,
Mm-hmm.
you know your body better than anybody. Even when you come to the hospital, you're going to have to describe to us what is wrong with you. So for things like headaches, oh yes, you can go to the pharmacist and get a painkiller, a simple painkiller, like the paracetamols for your headache. However, even in those adverts, I'm sure you see that they tell you that if after 3 days you're not getting better, consult your doctor. So that really is it.
Yeah, okay, well, actually, let me share an experience with you to buttress what you just said. So, a few weeks ago now, Jessica ran a temperature and they said, oh, she has malaria. And I said, well, let's just go to the hospital and just be sure. And they did all the checks and she didn't have any malaria parasite in her system. So, oh, it's an infection. And they gave her antibiotics and I'm like, oh, okay. So really, not all temperatures actually is caused by malaria.
Exactly.
Hmm.
Exactly. No, so the thing is, there are different symptoms for, I mean, like different illnesses, yes, let me put it that way, can have similar symptoms. So, case
Okay.
in point, a simple upper respiratory infection, like you have a cough, you have catarrh, you have a sore throat, may either be viral, may be caused by viruses, in which case they'll run its course, or they may be caused by um, bacteria. So, in which case, your doctor will prescribe you antibiotics. However, these same symptoms may be part of what you have when you have malaria. And as we can see in COVID, these are also symptoms that you get in COVID. So, at the end of the day, I've told you
Exactly.
three things now that will present you with a headache, with the cough, with the sore throat, possibly a catarrh, but they have different symptoms, which is why your doctor is very important.
Hmm. Somebody said the topic is most crucial at this moment when our youths abuse indiscriminately without their parents' knowledge. And the most used is tramadol, etc. And now Jamie, I'm actually still at a loss when you talk about drug abuse. And okay, so I was with my nail technician one day, and she just got up and popped three things into her mouth. I said, what's that? So I have this headache, so I'm taking Panadol. I said, three. So yes, it's so severe. I might even take a fourth one soon. I thought I could say Jack, she had chewed it, she was already drinking water. And I'm
So that is
saying,
another thing.
how?
Please go on,
Yeah,
ma.
go ahead. Go ahead. Go
So that's
ahead.
another thing in the definition of drug abuse. For some people, they think, oh, this drug, like what you just said, this paracetamol is not working enough. I'm going to take three. That is abuse because the
Mm,
prescribed medication, even for an adult, the prescribed dose rather, even for an adult, is 1,000 milligrams at once. So you can't come and take 1,005 and think that that is fine. Or one other common one is, oh, and you see this with older people. We're beginning to see it in younger people as well, but you see it more with older people. Oh, a grandma went to the hospital, she had knee pains, they prescribed her something. She gets together with her friend and they're talking about, the aches and pains of old age. I said, oh, this is what the doctor gave me, you should try it. And then there and then she pops her friend one or two pills and then tells her friend, oh, you can go and buy your own. And the friend never really gets to the doctor. So yes, we have all these situations are abuse. A lot of us are not, we don't know. That's another problem. We need to be educated. We need to understand that taking these drugs in this manner. So you're taking a drug for its side effects. Some
mm.
people take Piriton and they realize that it makes them sleep. So the next thing is I'm feeling sleepy. I'll pop one or two Puritans. I mean, a lot of people are guilty of things like that. It seems harmless in quote, but it is still abuse. So it's a whole spectrum of things, really.
It's a whole spectrum and it's huge. But Jamie, I'm wondering in my head, when you say, okay, like the grannies get together, And not just the grannies, even the younger
Yeah.
people. So somebody says to
Yes.
me, "Oh, are you using vitamin? Is Jessica using vitamin C?" And I say yes. And, "Oh, also add this and add this. They help strengthen immunity." And I'm like, "How many drugs do you want to give this babe?" I said, "No, no, 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 no. They help to strengthen immunity." So a communal consulting goes
Yes.
on everywhere every time. But then the truth is this: if I go to the doctor, they will charge me consultation fee, and I'm getting free consultation here. Why must I still then go to the doctor? I want
Because
you to make
you
money. Oh,
see,
I really want you to make money. But then we also want to save money.
so thank you. We have to make money, but beyond that, really, the thing with medicine is, um, the substance for any doctor is that they want to do their patients good. We have ethical codes and all that, and beyond money, we want to see our population well. As a public health physician, I can tell you that, I mean, our association people are working to make the population well. So, yes, you are getting quote unquote free consultation, but you know that half knowledge is dangerous. It's more dangerous than
Mm,
no knowledge, because somebody that does not know would admit and say they don't know. I mean, like I was somewhere the other day and somebody was saying, "Oh, COVID has gone," and my other friend who is a doctor had to say, "No, there is still COVID." And she was like, "Oh, but people are going out, but this, but that," and she seemed to quote unquote know. And she was like, "Oh, they have been vaccinated and all." But we also understand from what is happening now, sorry to digress, that
yeah.
being vaccinated does not mean we should still not observe the protocols.
Yeah.
So at the end of the day, I just use that as an example to say, and my friend was upset because she said, now if somebody else listens to her, they may want to follow her advice. So
Yeah.
really, it is, on the long run, it is a lot more beneficial to see your doctor, to see your healthcare practitioner. Now, for things like a headache, if you get to the pharmacy and you tell the pharmacist you have a headache, a simple headache, yes, you may be able to buy paracetamol. But even in the pharmacies these days, for some medication, you must get a prescription. The laws in Nigeria are beginning to work. There are some that you
Mm,
will not get if you don't get a prescription. Now, you use the case in point of abuse of things like tramadol. Now, thankfully, the government has really put a tight seal on that. And the thing is, those kinds of drugs are abused for their side effects. Like I said, people who abuse codeine, tramadol to get high. And like you said, we see this a lot in young populations. So that brings you to the social aspects of it. They want to get high. It's not because they're ill, it's not because they're experiencing any sickness or any illness that has to do with that medication, but they're using it for that effect. So on the long run, your doctor helps you to tie everything together. Your doctor understands the side effects of the medication they're giving you. Your doctor understands whether or not you need that medication. Also, because of the education and all behind it. And that's the thing. Healthcare professionals are supposed to all work together. So I'm a doctor. I write a prescription to a pharmacist who understands completely what I'm talking about, understands the side effects, and knows how to administer it. I mean, tell the patient to use it. So we're all supposed to work synergistically in that manner. So the doctor, the pharmacist that sells you the medication. However, not to digress, you should go to your doctor really.
mm.
I
You
mean,
should go
like
to
you
the
said, it's
doctor.
not every time you will go, like you don't have a simple headache and go, but the minute you realize that there is something wrong, it's better to go and see your doctor.
Hmm. Like somebody just said something here, and I just want to draw in on it before I take another question. He said, "So I like the taste of a cough expectorant, and I drink more than the dosage. I've just adjusted drugs." Ha! And the same thing, like, okay, I love the taste of this vitamin C, and I just pop like three, four in my mouth, and I'm chewing it. It's coming like sweet. After all, I'm building immunity. Some of these things. Are you saying that we should maintain and stay strictly? So if they say take this 5 ml, I should measure the 5 ml. When I can put it in my mouth, taking enough to fill my mouth, take it in. It's the easier way to take these things.
No, a lot of those medications come with measuring cups.
True.
Exactly. So you will be able to measure. A lot of your cups come with measuring cups. So, and it's there. Even for children, sometimes they come with these syringes. So you can actually measure accurately. So, but I understand that person. Well, not understand in the sense of being a doctor, but I get what she's trying to say. But no, it is still abuse. If your doctor prescribes you 10 mil of that cough syrup, no matter how sweet it is, please take 10 mils of that cough syrup and 10 mils only.
Wow. Okay, so the question on the floor is this. Some people say all medications are poison. Is this really true?
So yes, in a manner of speaking, I know one of my pharmacology lecturers used to say that all drugs are poisons. That is because the pharmacologist will tell you that really because at the end of the day, drugs may have side effects, and you know, and that is the thing with abusing these drugs. If you if you use more than is necessary of a particular drug, then you're exposing yourself to a higher risk of the side effects and maybe
Mm,
to a higher form of that side effect. Because if they think, okay, a regular adult dose of one tablet can give you this and this side effect, imagine you're taking two of that tablet at the same time. So yes, in that sense, the pharmacologist will tell you that all drugs are poisons because they have the potential effect. The same drug that, like, look at tramadol that you used for now, for example, the same tramadol that is a painkiller that will help people get well is the same drug that some people are abusing and they're developing mental health related issues. I mean, like, I watched your show with Dr. Juvenal. So, and they're developing mental health issues from those same kinds of drugs. So if you look at it, it's like a double-edged sword. On the one hand, it is very good for you, but on the other hand, you know, it can harm you.
mm.
So
Well,
if you're not using it according to prescription, yes, those drugs can harm you.
so let's come to the multivitamins, particularly in this COVID age, where everybody has prescribed for the other person. Take vitamin A, vitamin E, vitamin D, vitamin this, build your immunity. All of us have become quote and unquote COVID doctors. Is it also drug abuse? Multivitamins. Can we just go to the shop, buy them, use them, combine them to because nobody wants to die. No matter how hard we say life is, nobody wants to die. So we want to build immunity and want to just combine them. Even in multivitamins and supplements, is there drug abuse?
So with multivitamins and supplements, abuse in the sense of you may not actually even need that supplement, yes.
Hmm.
So for things like vitamin C, they're safe. So for some of those multivitamins, the researchers have done their work. There are safe zones, right? So yes, you may decide that, oh, I'm over 40, and I think you look at your body, you see yourself, you're not, a spring chicken, or no, let me not say 40. They say 40 is the new 21 or 16 or whatever. So, but you're older, and you think, oh, my body is not, I'm not as sprightly, I'm not as, and you feel like maybe you're tired all the time. You may talk to your pharmacist, and the pharmacist may say, oh, I have this multivitamin. Now, on that multivitamin, there is a prescribed take one a day, take two a day, and they tell you what is on it. So sometimes you may feel that is why those ones, they may be non-prescription over-the-counter drugs. You know, it's your body. Sometimes you may, but when it, even for those ones, you know that there are prescriptions, there are safe limits. Like for instance, vitamin C. A lot of people take vitamin C on a daily basis as an immune booster, but an adult should actually stay within the bounds of 1,000 milligrams a day, especially if it is
Really?
not prescription. Yes, especially if it's not prescription. So that's the thing. Even for vitamins, you may do a deficiency profile. They may actually check your blood and see what vitamins you're deficient in and let you know, and then you can use those on prescription. So some of those vitamins you can actually um take overdose of some of those vitamins, and it can be
Wow.
harmful. Yes.
Wow.
So some of them are safe, but some of them can actually still be harmful. So while yes, you don't have to go to your doctor for a prescription of I don't want to use brand names, but something that would
Mhm.
help you or whatever, you still it's still good to speak to your doctor, to be honest, at the end of the day. It's still good to
Wow.
speak to your doctor.
Jamie, this is getting tough. particularly today with the various herbal supplements out there. Again, I don't want to call names, but there are so many herbal supplements, and I
Yes.
hear there are no side effects. I hear there is nothing. So I'm a distributor for so and so company that's a herbal supplement, and I have like an array of six, seven. So I'm popping from one to the other to the other to the other because they're all supplements and we're told there are no side effects. Are you saying that it might just be drug abuse I'm practicing?
It just might be. Because the active ingredients in those herbal medications are, a lot of them are the same active ingredients in our quote unquote modern, the orthodox medicines that we use. And the problem with these herbal medications is you have to be sure, especially the ones that are properly packaged now. You have to be sure that the research that was done is correct. You have
Mm,
to be sure that you can trust it. Now, in the days of our grandmothers, etc., giving us the herbal concoctions that were not
yes,
measured, we don't know.
yes.
Yes, because these things have, you boil a leaf. That same leaf is used in the lab to create a tablet, a pill. But in the tablet, it is a controlled amount. They've done the trials. They know that, okay, an adult or a child should use this amount for this effect. They know, okay, this is how long this will stay in the body. But in your herbal medication, you really may not have that. They may not have done the trials to see before a drug is released. There are clinical trials that are done. So they test it and see that, okay, yes, this is how well it is tolerated. These are the side effects. This and this. That does not happen with some of this. You cannot guarantee that they're happening with these herbal medications.
Wow. Okay, so let me take still on those vitamins and all those herbal supplements. A prolonged use, is there any side effects? So I
Of
have this and
prolonged
I
use.
think it helps me. And I just keep using it year on year, year on year, year on year. Is there any reason for me to stop at some point and get a check?
Yes, everybody should get a check at least once a year. You should get a health screen, a wellness check, however you choose to call it, at least once a year. Because the thing about it is that the human body does not remain exactly the same. We grow from childhood into
Mm,
adulthood. And even in adulthood or even childhood, there are different phases of life. You're an infant, a child, you're an adolescent, you're pre-pubertal, an adolescent undergoing puberty, you're a young adult, then you're menopausal, then So there are different phases of life. So you really need to get a check. You can't just stay on one medication. And that is where the doctor's advice also comes in with your over-the-counter multivitamins. So like you go for your health check, and you just discuss it with your doctor. I would like to take this vitamin, or what do you think? What do you think I can do about this? So yes, it is important. You can't just take the same thing all the time. And like I said, some of them have long-term effects.
hmm. Some of them have long-term effects. So you're saying even in the long-term use of vitamins, we should talk to our doctor.
Yes, you should talk to your doctor.
I thought we could do this in 15 minutes. I wanted to cage it in 15 minutes because we are going to be back together again next week. But I want us to talk next week about the harder drugs. I want to, as much as possible, talk about all the simple drugs now. Now, like I'm primarily a microbiologist. Don't ask me any question. I've left it years. But one of the things I know is the fact that even the safe drugs like Panadol can really be abused. Now, when people say, I have this, in fact, I hear things like, I know myself, when I have this my migraine, this is what I use. So maybe I've been using one and the one is not working again. I go to two. And I know that it has an effect on the organs of the body. My question to you is this: should that be encouraged?
No, it cannot be encouraged. So you see, the thing with prescription medications is there's a reason they were prescribed. There is a way. So you go to the hospital. You agree with me that they do your vital signs first. They check your temperature, check your weight, check your height. Then you talk to the doctor, and then they probably listen to your chest, they feel your tummy, depending on what you've come to complain about. Now, when they give you this medication for migraines, it is based on your complaints, your body at that time. So the doctor may think, okay, this and this dose is okay for you. But if you're having the migraines are becoming worse and all, there may be other effects too on your body from the migraine that if you talk to your doctor, they may also be able to deal with. So increasing the dose and sitting at home will not help because there are other effects that can come along with that migraine, minus even what talking about the drug itself. So if your doctor evaluates you, your doctor will be able to say, oh, okay, use this,
Mhm.
add this, reduce this, and all. So that is also drug abuse in short.
Wow, that is also drug abuse. I have a question here on menopause and menopause treatment, but I'll keep that question for next week. I'll deliberately please ask you next week when we're talk about signs of menopause and what to do, how to handle menopause. I will keep it for next week because I actually want us to do 30 minutes today. You have talked about once in a year screening. You have talked about all of this
At least
indiscriminate,
once in a year.
at
Sorry,
least,
ma, at
oh,
least once.
at least once in a year. Wow, at least. But in this environment where health insurance is not really working at its best and disposable income is dropping, how can we save money when it comes to medicals?
Hmm. That is a tough question. Healthcare is expensive all over the world. And the thing with it is, like you said, because our insurance is not working optimally, you know, it may be a bit of a challenge. But really, if everybody can get a health insurance, so now there are some community based health insurance systems that, you can go to your health insurance company and talk to them and find out. You can be on a, even if you get something that is not very high premium, you know that you are guaranteed access to a hospital, when you need one. So health insurance really is the way. There are different forms of it now, but health insurance really is the way. Healthcare is expensive all over the world, so it really is difficult to save money on healthcare without doing health insurance. And that's the thing, which is why we, as public health professionals, we encourage health insurance because healthcare spending can be catastrophic. A person in a household can have a health emergency that can wipe off the
All the
finances of
savings.
the family. Because you know how you have loved ones and nobody wants their loved ones to die. So everybody will pitch in to do whatever. But if you have health insurance, you know that at least you are guaranteed the minimum care and then you can take it up from there. The person at least enters the health system and minimum care is begun. So really and truly health insurance is the way.
Hmm. Really and truly, health insurance is true. Somebody says health check in Nigeria, they are expensive, which is what I just talked about. Which way forward? Jamie, to be honest, um, people can do without clothes, yeah, but they can't do without food. So food is going to be priority over hospital, over doctor and doctor fees, and that is what has helped with communal consulting, like I called it. So I'm calling so and so person. When you had this thing, what did you do? And then that tells me what she did, and I just kukuma go and I do the same thing, not because I want to, but the truth is, I'm looking at the scarce resources and I'm trying to apportion it. Now, when you are saying go to the doctor, is there a cheaper way to go about it?
Okay, so currently some of the big labs, again, I will not be able to mention brand names.
Yeah.
Some lab do health screen checks for people because they've got the facility for it. And they now also, in fact, I know one of them that actually recruits doctors from all over and sends the reports to them. And those
Mm.
ones offer a cheaper alternative. But guess what? In the background, the doctors are still reporting these results. You get, the doctors are still helping with it in the background. So yes, you can find, I mean, like the healthcare industry in Nigeria is getting better. There are more privately owned facilities now. So you can shop around and check which one. But again, those people are licensed to do what they're doing. Like I said, they have doctors behind the scenes. So yes, you can do that as well. You may not necessarily need to go to a hospital. You can go to one of these brands, and at least as I'm speaking, I'm remembering one of them that I know that, you know, recruits doctors behind the scenes. So when you go there, do your health screen, a doctor reports, and
Mm,
you continue from
wow.
there.
Wow. So that's a good one. So for everybody on this call and those that will watch again, you can shop around for this organizations that are rendering this service, and they might be able to give you a much cheaper alternative than you just walking into the various hospitals, knowing that disposable income is dropping. I know the Lord meets every need. I know He keeps us in good health. But one of the things that we owe ourselves the duty is the duty of care. And like she said, at least once a year, just do the total check. Just be sure. Check in, check out. At least once in a year, do the total check. Dr. Damilola Matti, I want to sincerely thank you for coming on the show. We are coming back next week. And next week, now, one of the things we'll talk about next week that was not in our schedule before is menopause, and what are the symptoms and how can we handle ourselves at the time of menopause. When you look at the harder drugs, so we've talked about drug abuse in the simplest form, the panadols, the anti-malarias, but we want to go into the stronger ones, the antihypertensive. How long should we take it for before we go check it again? And then the harder drugs, the tramadols, the codeines, because codeine is also used to treat people. So
Yes.
I recall I had a challenge sometime, and one of the painkillers they gave to me was a version of codeine. And the doctor said to me, don't take it more than this one time. I just need to calm this pain. If you take it again, you might end up putting yourself under uh, uh, a situation you don't want. You get used to it, you're going to become drug abuse. And I'm like, but you gave me now. You are the one that gave it to me. You told I tasted of it and it was good. It calms the pain miraculously. They are telling me don't use it again. It's tough to keep to that rule of not using it again. How do we deal with these things? And maybe after your edition, I might be talking to somebody in the health insurance to let us know what actually is available for us in that sector. Thank you so much for bringing health insurance up. One of the beauty of Knox to Nuggets is that we just educate ourselves in every single area. So thank you so much, Dr. Damilola Matti. I don't take your comment for granted. Thank you for making out time at this time of the day, bring doctors and your schedules to talk to us on this. And also thank you for Dr. Yinka Jibono. She was fantastic. Thank you for bringing her on the show. And so I will not take your last words today because next week you are coming back. So for today, thank you so much, Dami. I appreciate.
Thank you so much for having me. To be honest, it's an honor to be on the same platform with you. Thank you
Thank,
so much.
thank you so much. So that's it, ladies and gentlemen. Drug abuse is real. Drug abuse is true. Everybody can abuse a drug. And like you heard her, even vitamins can be abused. If your body does not need it and you are taking it, there's vitamin overload. And that's a critical thing you also don't want to get into. So I'm appealing to every single person on this show. Talk to your doctor. Do a total check at least once in a year. Give it your best shot and never forget it. Like I will always say, if you can think it, you can do it, you can be it. And until I come your way, next week edition of Knox to Nuggets, still with Dr. Damilola Matti. Never forget it. Together we win. Have a blessed week ahead. God bless you.